Hey folks, so today we'll be doing another mock USMLE question. This is going to be question number 23. So the question is, you have a 65-year-old male with past medical history of high blood pressure and CVA with no residual deficits who comes to the ED with acute onset pain and swelling in his right leg. Of note, patient is post-op day 1 for ORIF of his right leg, secondary to tibial plateau fracture. Patient reports significant tenderness of palpation of his right leg, along with an inability to flex or extend at the knee or ankle joint. Temperature is 36.5, blood pressure is 133/94, and pulse is 94 beats a minute. Physical examination reveals a tense, swollen right leg with decreased sensation of light touch. Pulses are intact distally. Laboratory findings remain pending. What is the most appropriate treatment for this patient? The options are immediate fasciotomy, elevation and ice application, NSAIDs, or serial physical examination every 2 hours. Take a second to pause this question if you need more time. The correct answer is immediate fasciotomy. So reading this question, this patient has several classical findings that we see in compartment syndrome, where the patient reports significant tenderness of palpation. Patient has paralysis given inability to flex or extend his knees. And then patient is also noted to have decreased sensation. So once again, this patient has several classical signs for acute compartment syndrome, which can happen in the setting of orthopedic injury. And so the treatment for compartment syndrome is immediate fasciotomy. You want to open up those fascial compartments and relieve pressure within those compartments and allow their essentially remove pressure from the nerves and arteries that are being compressed. And so that's why, once again, this patient with suspected compartment syndrome, the answer is immediate fasciotomy. One thing I'll briefly mention is, in this question, I did state that the pulses are intact distally. You might be wondering, well, doesn't this go against the clinical picture of being compartment syndrome? The thing that you have to remember is pulses are one of the final things to go in patients with compartment syndrome. And so just because a patient has intact distal pulses doesn't mean that they don't have compartment syndrome. So it's important to be aware that patients with compartment syndrome, you're not going to always see all the clinical findings. And when it comes to compartment syndrome, the thing that I recommend that you memorize are the 5 P's of compartment syndrome, which are very frequently tested, particularly if you end up doing an orthopedic rotation. So the 5 P's of compartment syndrome are pain, paresthesias, pallor, paralysis, and lack of pulse, P. So if a patient has several of those P's, particularly in the setting of recent trauma, you should have a very high clinical suspicion for compartment syndrome. And once again, the treatment for compartment syndrome will be that immediate fasciotomy to relieve the pressure. The one thing that's also important to remember is compartment syndrome tends to happen most frequently in the leg. And in particular, within the leg, there are 4 compartments: the anterior, lateral, posterior, superficial, and posterior deep. Most frequently tends to happen at the anterior compartment, but it's important to remember that compartment syndrome can happen anywhere in the body. It can even happen in the abdomen. But once again, most frequently tends to happen at the anterior compartment of the leg, and no matter where you have the compartment syndrome, the treatment will be doing a fasciotomy to relieve that pressure. So that's going to be it for today. If anyone has any questions, feel free to drop a comment down below.